I'm Gordon Kelly, and that was Amazing Grace performed by my friend Dr. Bill Akpinar. Thank you for joining me again, Bill, for the series on health and
wellness.
Health and wellness. Bill, today we're going to talk a little bit about sweat therapy, and I hope that the audience is not out there sweating bullets as we talk about this. But tell me a little bit about, Bill, you have a training in pain management, MD, Doctor of Dental Surgery, PhD. How do these all come together in a sweat therapy, a heat therapy? I know I've heard of saunas and the Indian sweat lodges. What are, the history of this, Bill?
Well, before we get into that, Gordon, I'd like to wish that everyone does break out into a good sweat, all of our viewers, because it's the ancient medicine. It goes back probably 5, 10, 20,000 years. And essentially, they all tie in because it really is a magnificent backbone of health. It's probably one of the oldest health traditions in the world.
And it's a communal, you'd get together, they would all get together to detox. They knew this innately, that they would detox their body. And the benefits of the health, some of the things that you were talking about, we had spoken earlier about the temperatures that come up, way up with the body, temperature rising that. What exactly goes on with the hypothalamus and detoxifying and anti-aging and the ancients, they didn't have the scientific background to back these up, Bill.
Yeah, Gordon, that's such a good point, because how did they know that they knew it worked somehow? They knew that this was good medicine. They didn't have the AMA, they didn't have the FDA, they didn't have double-blind studies, but yet innately, intuitively, people knew this the world over. I mean, when you look at these therapies or these rituals, I go back quite some ways with this. The Native Americans, I work with the Native American cultures. We've worked intimately to help improve the lifestyles, health challenges there, and I've partaken in many, numerous sweat therapy rituals with them.
I would like to add a little bit on Bill's background as being an MD, but you're also ordained as a minister.
Yes.
In a sweat lodge.
Yes.
Was that in the Shinnecock Nation?
Yes.
Was that
yes.
Here on Long Island?
I've worked with the Shinnecock, with the Kiowa Indian Nations, and other nations, in an effort to improve health and consciousness and disseminate knowledge, health knowledge and wisdom.
You've given so generously and abundantly to that nation, and I know that they're appreciating that. But getting into that sweat lodge,
yes,
being an ordained minister, this little bit of spiritual and the detox of the environmental, our own spiritual detoxifying, and the heat that comes out in a sauna. What is some of the ideal temperatures? We all know when it's 100 degrees out, we're perspiring like crazy.
Right, correct. Well, in as much as I've given, Gordon, I've gained back many-fold in spirituality and knowledge and wisdom in traditions. So I also am a beneficiary, probably to a very high degree, of wisdom and traditions. Now, the Native American sweat lodge is a, like you said, it's a very communal ritual. There's a lot of prayer, a lot of spirituality in it. There's sweat lodges in many cultures and countries. Russia, they use the banya. The Finnish, the Scandinavians, the people of that region have utilized the sweat ceremony, the sweat, not a lodge, but the sauna, to such a high degree that they would build the house around the sauna. The sauna would be built first, and then the house would be designed around it. You have the hammam, which goes back to the Ottoman Empire, and the Ottomans used to call this the secret doctor, as they say, the gizli doktor, the secret or the hidden doctor within, because they really honed in on the therapeutic value. So this tradition goes back so far. It's ingrained in the history of humanity, and the benefits are so far-reaching.
Bill, some of those benefits that we've spoken before in the past, I've experienced myself. I've taken the sauna in your office repeatedly. Was it an infrared
Yes.
sauna? Does it penetrates down into the
Yes.
skin?
Yes. There are many different types of sweat therapies that one can engage in. You could use steam. You could use the heat sauna, the infrared, the far infrared, the dry heat sauna. Sometimes when I travel, there's no sauna. I'll fill up the bathtub and just kind of soak, put some salts to get a sweat to detox and get all the pollutants from the flying and the food and everything else. So there's many different types. The far infrared, you're correct about that, Gordon, penetrates up to 1.5 to 1.75 inches into the body at a spectrum of about between 7 and 14 microns. Now, keep in mind that the Schumann resonance, the vibrational frequency of the Earth, of Mother Earth, where we're living, is about 7.83, and this is very much in line with our own resonance, but being that it penetrates, it breaks up a lot of the toxins, the poisons, all the garbage that's collected in the fat tissue.
These vibrations, but now with that, is there an ideal temperature that is coming up that, I mean, you just don't want to have a lower temperature as a warm day. It doesn't really do it. You said getting in a hot tub, but there's also the benefit of getting in the sauna. What actually happens to our body? We're very concerned about a child, a young person having a fever. You definitely do not want to go into a sauna if you're having feverish or anything like that. But as far as these breaking up of fat molecules, cancer molecules, do they sort of, are they destroyed by this heat? Is it a detoxification?
Yes, detoxification is one of the main benefits of the sauna. And yes, like getting back to the Native American sweat lodge, the temperatures in there could be intense, and it's also a test of your spirituality, your dedication, your conviction. A far infrared sauna, you don't need quite as much heat, perhaps 110, 115, 120 degrees. And the bottom line is, you're deriving a physiologic, a biochemical, a health benefit from this. Now, if we were to look at some of the benefits, you know, if we look at the 3 main causes of death in society, unfortunately, cardiovascular, stroke, and cancer. And I hate to say it, cancer is slowly, it's number 3, but it's creeping up to number 1. In about 20 years, they estimate that it's going to go from number 3 to number 2 and possibly number 1. Now, on the cardiovascular plane, if we're to get a little technical for a minute, the coronary arteries, which are the main feeding arteries of the heart, have a blood flow of about 225 milliliters per minute. During a sweat therapy session, a sauna, this goes up 5, 6, 7-fold. So you're cooking out the fibrin, the goo, all the garbage, all the nasty stuff that can deposit in there and form disease and atherosclerosis and all these other unwanted sequelae of poor living and, you know, mind, body, spirit disharmony. On the neurological plane, it's been shown that engaging in some form of sweat therapy regularly helps increase the cognitive function in people. So after 3, 4, or 5 weeks, people actually get smarter. The brain hemispheres are more active. Blood flow to the brain becomes more enhanced. And if we look at the demise of brain cells, like the brain, the white and the gray matter is lost at a rate of about 0.5% each year. So we're losing neurons. The neurons, the garbage between the neurons, the lipofuchsin, all the toxic products are creating a scaffolding for disease, especially if people have had head trauma and childhood injuries. It exacerbates it by introducing heat and you know, via sweat therapy, you are actually working the brain out. It's like an aerobic workout for the blood vessels in the brain.
And would that also be help to anti-aging?
Oh, absolutely. Now,
detox.
That's a good point you touched on, Gordon. Anti-aging is dependent on the demise of the cells of the body. We know that the telomeres pull the cells apart. They're like shoelaces, and as they get frayed and the cells divide more and more, they copy. Each successive copy is like a copy of the copy. So if you were to do that on a piece of paper, you'd copy the successive copy until you wouldn't see anything. The copying is accelerated by poor living, toxins, stress. And, you know, this can all be helped by the right living, sweat therapy, opening up the blood vessels, detoxifying. Now, as far as the detoxification is concerned, the kidneys and the liver, we know, are the main detoxifying organs of the body. It's said in Chinese medicine that by the time we hit 40, half of the kidney qi, or the nephrons, the components of the kidney, are destroyed. Why? Penicillin, antibiotics we took as children, food coloring, chemicals, poison.
Lack of water, not enough water.
Not enough water, inefficient metabolism. So what are you doing? You're driving on a spare tire that's already being worn out. When you engage in sweat therapy, you touched upon the hypothalamus and sweat glands before. The sweat glands, of which there are two types, the eccrine and the apocrine, they open up. The hypothalamus gets the message that, wow, you know, we're being heated up a little too much. Well, the hypothalamus also governs sleep, which is very important. Like when you sweat, you're also stimulating that part of the brain that helps you sleep better. So it says to the sweat glands, open up. I don't want to be cooked. It's releasing all the garbage. So what's happening, the uric acid, all the wastes are now not having to come out of the kidney, but they're being released through the third kidney, otherwise known as the skin. So you're bypassing some of the detoxification mechanisms and not wearing them down. This is why we recommend it for people, you know, like everything else, you know, check with your physician, get health clearance. But for people that have kidney failure, that need dialysis, you're sparing the kidneys. You're not aging as fast.
You said something, are there contraindications of sweat therapy? I know that you are losing water, you're perspiring, you're cooling your body down.
Right. There's certain precautions one should take, Gordon. Take minerals, take certain supplements, and you know, there's a whole ritual that we're going to get into one day, showing a little pre-sauna stretch, coming out, stretching some more, some breathing, a complete format that we're going to give our viewers. But generally speaking, most people can engage in sweat therapy with medical guidance and supervision, of course, but there's one particular situation, the complete absence or lack of numbers of sweat glands, congenitally missing sweat glands, anhydria.
Somebody was born that way.
Right. Those people should engage in other detoxification protocols. Exactly.
Other than that, just about anybody can get in there. Young children as well?
Yes, just you have to be more careful because their thermoregulatory centers, you know, namely, once again, the hypothalamus, is not as developed. That's why when you see a child spiking a fever, they can spike a fever very fast, and you have to be very careful. The thermoregulatory mechanism on an adult is different from that of a child.
Controlled by the hypothalamus.
Yes.
And ideally, where our normal body temperature is
98.6 with minor variations.
When you're in that sauna, your body temperature is going to go up.
It's going to go up, Gordon.
Where are you going to start to get that benefit of that heat coming on?
When you start sweating. The minute you start sweating, the hypothalamus, you see, is not going to let the body go beyond 101, perhaps 102 degrees. At 103, 104, 105, you're going to get seizures, convulsions. So the hypothalamus has a mechanism, there's a vascular and a neurogenic mechanism which controls the temperature. But now, all the blood is going through the periphery, through the outside. It's being exposed to temperatures of 110, 120, 125, 130 degrees. What's happening to microorganisms that cause disease? Virus, bacteria, fungus, they die at 104, 105 degrees. Cancer cells begin to die at 104, 105 degrees. This is an incredible mechanism to regain, protect, and reclaim your health, but it's just not really being utilized.
For a healthy adult, or not, I'm going to say that's contradicting, but for an adult, not a young child or somebody that has some sort of a severe illness, but you're going to get those temperatures up.
Correct.
They're going to start to actually burn off the cancer cells?
You will actually now, a lot of clinics, including Duke University, they're using hyperthermia along with radiation and chemotherapy. So they're using it, and the effectiveness of these treatments when combined with hyperthermia or heat therapy becomes enhanced. The success rate goes up exponentially. So it's an amazing adjunct in and of itself. It's phenomenal. Combined with other therapies, it's great. It's, you know, when you look at most disease is a result of toxicity, mind, body, spirit. Where did the you know, that's why I always say, let us all pray for clarity of mind, for peace in our souls, in our hearts, that we may have divine blessings, protection, that we may say, we may be guided to have the right intention, the right thought, the right speech, the right outcome, the right livelihood. And when you look at the lives of most people, especially in today's society, we take on toxicity. Now, it's not only mind, body, we're actually taking on physical toxicity, Gordon, via the chemicals and environmental toxicity. Where do these toxins build up? In the fat cells. What happens when we go into a sauna? At 110 degrees, fat cells begin to liquefy and these toxins begin to come out of the body.
Bill, as the American Cancer Society Man of the Year, this is quite a tribute to you, Bill, as a medical doctor, as a DDS, a PhD in pain management. Are you, with this heat therapy, are you actually to alleviate a patient's symptoms of pain?
At the minimum, Gordon, it's a wonderful adjunct. It's complementary medicine to whatever else the person engages in. You know, if a person's belief systems will dictate what course they will take. But at the very minimum, this is a cornerstone of health.
So the number one complaint people come into your offices, they are complaining of pain. You deal with TMJ. Pain management. And on the other side of this, of also a detoxifying, you've worked for years with the Eric Clapton Crossroads Clinic in the Caribbean.
One of my heroes, who I had
all of ours.
All of ours, yeah. We had the opportunity to pay tribute, and I went down to Antigua and trained his staff in Qigong, in acupuncture, the use of Chinese herbs, and recommended the use of sauna therapies. And that's a good point you touched upon, Gordon, because no pain management or addiction detox program would be complete without the use of some form of heat detoxification, heat therapy, because the heat, not only does it detoxify physically, it brings neurotransmitters, it brings blood oxygen to the brain. So what are you enhancing? You're enhancing the endorphins, dynorphins, enkephalins, all the opioids, the body's own self-produced opioids. The feel-good chemicals. You'd have to go and spend thousands of dollars to buy in a prescription or in a shot what you're producing yourself. So for someone who needs, who has an addiction problem, you're creating a sense of calm, euphoria, and sense of wellness by having this person engage in a sweat therapy.
A part of our healing process is also to be able to have a good, long, healthy sleep at night.
Yes.
And when I've gone to your office and I've taken the saunas, you go home, you sleep great. You sleep like a baby.
Yes.
Tell me a little bit, does it affect your sleep? Is there connection on how that helps your sleep? We're talking about the pain it helps, detoxifying, anti-aging, your sleep, your other functions during the day?
Yes. Once again, going back to the hypothalamus, this part of the brain regulates not only sleep, but detoxification through opening up the sweat glands. Now, when a person engages in sweat therapy, what happens, as we indicated before, a lot of these feel-good chemicals are released. Do you know, in the United States, literally hundreds of millions of sleep medications are written each year. And it's tragic because a lot of these cause overdose, a lot of these cause toxic reactions. When you're sitting in a sauna, you're producing these chemicals naturally. And here's another point. One of the reasons that people can't sleep is because they're in pain. So when you're sitting in a sauna or engaging in some form of sweat therapy, what's happening is you're opening up the blood vessels. Skeletal blood flow takes place at about 3, 4, 5 millimeters per 100 grams of muscle. When you're expanding these via heat, these go up 10, 15-fold. What's happening to the distance between these blood vessels? Diminishing. You're removing toxins. You're removing lactic acid. You're removing all the poisons in the muscles that cause cramping, that cause spasm. So you're getting rid of pain.
And Bill, is that also part of that, getting rid of that pain, is that would be involved with maybe the lymphatic drainage system with that heat? Does it affect your lymphatic system as well?
Yes, the lymphatics also get a good cleaning, a benefit.
Benefit from that heat?
Yes.
And there's also something very interesting about this, cost effectiveness.
Yes.
Today, people are going bankruptcy, medical bills, everything like that. This has been used since the beginning of time. It's cost effective. Tell me a little bit about a sauna, that you could actually have one in your own home.
Yes, the sauna is very expensive, actually. It costs a few.
It's a luxury item.
I'm talking about, it costs a few pennies each use. So.
Okay, I got you now.
But actually, no.
Cost effective.
Yeah, most saunas are pretty affordable these days. You know, we have one that we use that we recommend. They're affordable, and your biggest expense after you purchase it is electricity. Okay, that's about it. But it really is indeed a very cost-effective, time-tested, and useful mode of health enhancement. Now, I recommend it for everyone almost, you know, with the few notable exceptions that we mentioned before.
Would you do any exercises before you go into a sauna or after a sauna? And would it be some sort of a protocol that you'd want to go in with a sauna? Would you want to load up, obviously, with a lot of fluids beforehand?
Yes.
Coconut water or something that's pure and good?
Coconut water is very good. It's very compatible with, as far as the electrolytes that it contains. Water is very good. You know, load up on some water. My protocol will do a whole show on this, Gordon, a complete pre-sauna stretch, come out, do a little intra-sauna stretch, some breathing techniques in the sauna, and you go out and you rest and you relax. It's very important to make this time, take the time to relax.
Bill, there's an interesting book here, No Sweat, by an author. I wish I could think of his name. Oh, Bill, you wrote that book.
I did.
And you were recently at a conference in which you were involved with the Nobel laureate family.
Yes.
Could you tell us a little bit? We might have a couple of photographs of that, hopefully that will pull up on the show. But tell me about the Nobel laureate and what they're doing. Are they involved with this? I see on the bottom of it's the University of
Health and Spiritual Sciences.
That you helped found in our last
Yes.
show. We spoke about that in the conversation with Dr. Bill. Those were the closing comments that you made.
Yes.
And what does the fine line underneath here on No Sweat says?
Well, I happen to know this book a little bit, Gordon.
A series?
And, you know, I've put, actually, it's the Dr. Bill's Health and Wellness series. This is my give back to society, to the world, to give my knowledge from my travels, my research, all the education that I've taken, all the classroom studies that this ADD person has sat in over the years and tried to impart upon our viewers and my patients, of course, our friends, our family. Now, Klaus Nobel is a wonderful human being, and he and his group have organized the World Peace One movement, and God knows we need this at this time.
And you were at that conference. I spoke to you
I was
by
at the
telephone.
conference, and we're working closely together to form a liaison, a union, an educational union between our universities and our educational institutions, and using education and music and just mutual respect and love to bring the world closer together.
And education, music, sweat therapies, these were all little or no cost at all.
That's right.
And they've been going on since the beginning of time.
That's right.
We've discussed how you can detoxify,
Yes.
better sleep, pain management.
Yes.
What are some of the other, you know, we know who should not go in a
Let's see,
sauna, how should go in a sauna.
There's so many, it would take us 3 hours to cover them all, but let's look at the American diet, okay? Salt. We're not supposed to really take more than 2,300 grams of salt. What does the American diet involve? Fast foods, all sorts of salty French fries, hamburgers, all these. So you easily hit 3, 4, 5,000 milligrams in an average day. What's the best way of getting rid of salt? Sweating. You can replenish it by taking minerals, like you said, coconut juices and other mineral supplements.
Vital. It's very important.
Right. Fat burning, amazing, amazing way to burn fat. 400 to 600 calories per use of sauna, even 600, 700, 800 calories. So why take something that's going to have potential side effects when you can sit inside a sauna, relax, and feel great?
Bill, a sweat therapy, a sauna, a detoxification. We spoke about anti-aging, cost effectiveness. Elaborate a little bit more. I know that you get into a stream of consciousness and think about this. Some of the language you gave us was very technical, but there was also, we're going to wrap this up right now, but we're going to have to save this for another show. And I do thank you for that broad overview, my dear friend, Dr. Bill Akpinar. And help me again with this, the university, Bill, underneath here?
It's the University of Health and Spiritual Sciences, and we have affiliated with World Peace One, which is a phenomenal organization who is spearheaded by a wonderful human being, Klaus Nobel, who is the family, really, the preeminent person who handles and takes care of the Peace Prize.
Thank you for joining us, and thank you for tuning in for a conversation with Dr. Bill in his series of health and wellness.
Thank you.
Thank you, Bill.
Thank you, Gordon. And thank you to everybody.